system of no, you don't qualify, or no, you should have paid more, or you should have paid less, or whatever. And so we got to take the investment out of health insurance. And so, but in order to do that, I think it's going to be a multi-step process. I don't think we're going to get to it right away. And it may be that it's a hybrid of, if you want to buy something, a long-term care, for example, policy, or an additional policy for something, that you can do that in conjunction with. But a big part of what is going to have to happen is we need a president and a legislature at the federal level that's willing to give us two really important waivers. And one is a waiver that says we can take everybody right now that's covered by Medi-Cal, we can take their money and put it in a pool. So if you're receiving Medi-Cal right now, you'd have to agree that your money goes into a pool. And if Robert's on Medi-Cal and the money goes into a pool, he has to agree, number two, that I can pull the money out because they need it for me. So the first waiver is that the money could go into a pool, and the second waiver is it can be used for anybody, right? Because it's universal for everybody. And that changes. That's not a system that's in place right now. So I think that there have been extensive discussions and work done on how do we get there. I think there eventually will come together a plan. But right now what we need to do is to start solving some of the abuses, and like the prescription abuses, and we've got to figure out a way to be able to get people medication that are ill, and I include physical illness as well as mental illness. It breaks my heart to hear that there are people with mental illnesses that can't get their prescriptions filled because they can't get in to see a psychiatrist. Or if they get in to see a psychiatrist, they don't have money for the copay to get the medication that'll keep them stabilized. And the same goes with diabetes and some of the other issues. And so I think you're going to see some changes, whether it happens at the federal level or whether the state starts taking control out of that. And the governor, to his credit, I think yesterday or the day before, basically came out and said the exact same thing. So he's looking for ways for California to be able to create the market for the, well, we utilize a lot of those same medications over and over, and to start bidding against the different companies so that we can bring down the cost. And so part of that is looking at the way to bring down the cost. And there is a commitment, I believe it's in the governor's budget, to start covering undocumented workers.
Yeah, and I completely agree with Anna. I think, obviously universal care and coverage is a great goal, and we all want to get there, but certainly the politics probably won't allow us to do that. And so taking this incremental approach, because there's certainly a lot of opportunity to improve our current system. When you look at our region in particular, for me it's about access to quality health care. This for-profit model is breaking down. I mean, you look at, in this assembly district that I represent, my own hometown hospital, they talked about possibly closing down, Hazel Hawkins Hospital. Santa Teresa Hospital in Gilroy is on the verge of closing their doors. And I believe the County of Santa Clara had to come in and purchase the hospital. It was a big fiasco. But certainly in this region, when you talk about making sure that insurance coverage is affordable for our families. Prior to coming here, I was in a meeting with a labor rep talking about how families making the lowest wages have to pay $1,500 a month out of pocket for insurance. And then we're just talking about housing. This stuff doesn't work. And so certainly, and aside from the insurance part, which is as Anna just highlighted, is very, very broken. You talk about access to quality healthcare facilities and doctors, and it's very, very challenging. And so certainly there's a lot of ways that we can improve the system. And certainly it's 2018, and when you look at healthcare, it's so fragmented. How there's a lack of I could get on my phone right now and call an Uber to come pick me up, but I can't have a central location to look at all my medical documents. Where there's just such a lack of integration when it comes to technology. And more people are suffering because of that. Because things slip through the cracks. If they got a treatment or a misdiagnosis, there's just no comprehensive system that works and functions together. And so certainly there's huge opportunity, but ultimately it's about the care for people. And so certainly making sure that we do bring down the cost for everyone is a challenging task. And certainly when you talk about, here in California, we're just one state of 50, and certainly making sure that we have the right Congress in place. I mean, a lot of things have to happen, but certainly there's a lot of opportunity and there's a lot of momentum to fix our current healthcare system.
A good friend of mine is the only labor leader that supported me when I ran for election, because I'm the only elected Republican for about 5,000 miles a year. I wasn't going to change, so everybody else said, well, we won't support him, he's a Republican. And Crescencio Diaz with the Teamsters came in. A man I really have a lot of respect for, and he said, Judge, the thing my people need, he said, we just did a strike on Taylor for a day and we got a little more money, but he said, that wasn't the thing. If you have affordable housing for my workforce and health care for my workforce, that's what we need. Two things that we've talked about here, but we're working on that. Natividad Hospital is doing well financially. I know when they built that hospital originally, they took $30 million I had for a new courthouse for cost overruns. Because you imagine how committed I was to Natividad, but I mean, especially with the new trauma center, they've done an excellent job, and they're looking to develop more clinics to reach out to the people. And I know the labor Teamsters and I forget another group are working together to establish their own clinic to have more affordable health care. And so Natividad is branching out to have the clinic so everybody's not having to go in there, and being open at times when, on Saturdays and Sundays and after work, where we get people in. And our county did start something. I took some convincing for it, but where we started the Esperanza Care Project, which is all those extra things. If someone goes to the emergency and they're undocumented, they can get treated. But then all those things, like I have bad lungs, so I have the breathing thing I have to take every day. Well, if the person goes in because they got asthma, but then they can't afford to buy what they need, then the result is they come back into the emergency in 2 weeks. So all those accessory things that I think we're giving them about $30,000 as a start, and we probably will this year because it's been a pretty successful program, and it's provided the things that they need for that. And they're talking about looking at that as kind of a state issue and a bit of a model. So those are some of the things. Of all the hospitals, though, and when they built Natividad Hospital, my guy who was the administrative genius, a retired general, Tom Kennan, said, everybody else is getting out of the hospital business, but and everybody was. And Natividad struggled for a long time, but it's turned around, and they are doing a good job.
Well, credit the Board of Supervisors for that, because in most other counties, there's not a county hospital. And the challenge in this healthcare space is that we can give everybody health coverage. But if there are no providers, then we haven't done what we need to do. So the 12th Senate district, 2/3 of the district is in the Central Valley. And there are 27 cities and probably close to 37 county unincorporated areas. So I've visited most of those areas. And people have to get in a vehicle, so they have to find a ride, and they have to travel at least 30 miles in order to get a prescription filled. And so one of the bills that I'm working on, and so again, we don't end up with universal health care right away, but we have medical trained personnel that are constrained by what they can do because there's a good lobbying arm of the Medical Association. And I love them. I've worked with the doctors for many years, and the medical profession is changing, but physicians' assistants and nurse practitioners have the ability to do, well, if you go in to see your doctor, you're probably seeing them. They do all of the work. And the experience I have is my mother is a registered nurse, and she was the family doctor for everybody. At 2 o'clock in the morning, she got the phone calls about, so-and-so's running 103-degree temperature. Do I need to take them into the emergency room? And she could talk them off the ledge, tell them what to do until they could go in the morning. And so the bill I'm working on is to create the opportunity for physicians' assistants to be able to work a little bit more independently. Their work still has to be signed off, but they can work without some of the constraints they have right now. And there's the same bill on the nurse practitioners as well in the assembly side. And so my vision is that some of these clinics will put storefront facilities where you can just drop in. It's the doc in the box thing, but there are these trained personnel, and a lot of what people need is the prevention stuff, which is how do you avoid diabetes? How do you avoid high blood pressure? How do you avoid some of these things that are part of how we eat and our lifestyle? And if we can change some of those, we can start to control some of the illnesses that are really prevalent, in particular the farm worker community, because diabetes is very, very high, and a lot of it comes with unhealthy eating. And frankly, the other thing that I'm pushing for is that there's a study been done in Rhode Island. This is from the Govern for California group. Is that they're using data that is collected on a regular basis by government to make some analysis of what needs to be done. And what they found is people eat healthier when they have people will spend more money when they have it to buy the food that's healthier. But if you do food stamps, the EBS cards once a month, at the beginning of the month they do really well, and at the end of the month they're because we all have trouble trying to manage getting paid once a month. The healthy food choices decline significantly. Why? Because it's cheaper to eat crap than it is to eat healthy. So they move to the unhealthy stuff. And so they discovered that if you make the switch to filling the card twice a month rather than once a month, that people's food choices improve during the whole month. So it's understanding the data and then utilizing it to make good healthcare kinds of choices, and we just need to know some of that. It was really fascinating.
Yeah, and I'm glad Anna brought up the point, and Judge highlighted it as well. When we talk about healthcare, I think Newsom has done a good job to highlight the fact that as a state we're growing older, and so when you think about healthcare and just about the level of care we receive, the access to care and insurance, we also have to think about our elderly and their ability to age in place affordably, and that's why I think, as the judge mentioned, housing is key in this whole this discussion, making sure that we strategically locate housing near healthcare facilities, and then also the governor's commitment to increase funding for the whole person care pilot program, making sure that we're taking this integrated approach. And we talked about homelessness earlier and the challenges here. We faced this in San Benito when I was a supervisor, and when we talk about the pushback we just did it. And what we found out was all of the concerns of, homeless are going to be lingering around. You have to drag the homeless to go to those facilities because they don't want to be there. That's half the battle, to try to treat them. But part of the program and the success we've had is this whole person care, is providing people with this integrated framework to how they care for themselves and assigning caseworkers to them, and not shopping them around and saying, you have to go here for your preventative care, you got to go here for this service. It's all integrated. And guess what happens is we get positive outcomes from that. And so that's why we're really reinventing the way we think about healthcare in many ways.
If you're going to build something and you want to get a permit, go to San Benito County. They cut through the red tape and do it.
All right. Now is the time when we open it up for the audience. What questions do you have for our panel?
Good morning. My name is Josh Mathis. I work for the United Way of Monterey County. Thank you for presenting today and giving us the opportunity to speak with you guys. The United Ways of California real cost measure shows that 38% of residents don't have enough income to meet their expenses. And we know there's a lot of reasons why. We talked about a lot of it today, but two things I'd like to ask you about. One is access to quality and affordable childcare, and one is access to financial services and predatory lending. for predatory lending, there's more payday lenders in California than there is Starbucks and McDonald's. In Watsonville, for every financial institution, there's 3 payday lenders. And I'm just curious, we know that our residents get trapped in this cycle of debt. I know 8539 is legislation that would cap payday lending at 36%. So wondering what your position is on that in terms of quality and affordable childcare. There's 9,000 licensed slots for 38,000 kids, 0 through 5. 75% of our kids are not kindergarten ready. So just wondering what your position is on increasing access to quality and affordable childcare. Thank you.
I think the governor, as we can talk about where he's going to land on all these different priorities and whatnot, he's made very clear, especially from the budget he introduced in January, a commitment to, make this a budget priority as far as expanding our early childhood care education access. And so certainly, the devil's in the details and obviously funding. And so I know there's a number of bills in the legislature now that, we're debating. And